the involuntary commitment process is an important process in our system, and it's a safeguard to ensure that people who absolutely need care at that moment because of safety concerns for themselves or others are getting the care that they need. In North Carolina, unfortunately, we've seen the involuntary commitment process sometimes be co-opted for other interests, such as transportation. People essentially not being able to get to care on a consistent basis. And so an involuntary commitment allows that person to be transported to get the medical care that they need. NAMI North Carolina believes that if we had a stronger array of community services, involuntary commitment wouldn't need to be utilized as much. There's a variety of people who choose to be the petitioners on the involuntary commitment papers, whether that be a family member who's at the end of their rope and just wants to see their family member get the help that they need. It'd be a provider. It'd be someone else who's close to that individual. And nobody takes that process lightly, especially when they care about that person. And if we can ensure that people are taken care of at a holistic level in their communities, just like for other chronic care conditions, then perhaps involuntary commitments would only be used in those very dire situations where every avenue has been pursued that's available to that person.
I have a follow-up question. So one of the aspects of IVC is that the statute hasn't been updated in 20 years. Mm-hmm. So it's antiquated, or maybe it's been augmented over 20 years. What's wrong with it, the IVC process today? Is it too easy? I guess is the question.
Yeah. One of the parts of the IVC process, or involuntary commitment process, that that gives us heartburn, us being NAMI North Carolina, is how it really criminalizes mental illness. If I were to have a medical emergency, such as a heart attack or a seizure, I wouldn't be transported in a police car. I would have EMS come to wherever I am and transport me to a hospital and treat me with dignity and respect in terms of if restraints had to be used, they'd be medical restraints. They wouldn't be handcuffs. And using tactics that we would in the criminal justice system just further stigmatizes what mental illness looks like in our community. It's to be feared. It's something that we don't understand, and we need to treat it like any other medical illness.